Fibroids are masses that grow in the wall of the uterus. The uterus is the womb that carries the baby. The uterus is the area where we have our menstrual cycles from. So in the wall of the uterus, a disorganized growth of the muscle can happen, and it forms masses or balls within the uterus. They can be of various locations, the top of the uterus, the front, the back. Sometimes we even see fibroids along the fallopian tubes, and rarely outside of the uterine. And based on their location and size, they can cause a host of symptoms. Some range from bleeding, pain, pressure, painful sex, problems with urinating, sometimes even problems with moving bowels. Fibroids are very common. They're very common. We do see them more in ethnic groups, but we've seen them certainly across all ethnicities. They tend to present earlier and much more seriously in African American patients, and we do see them in some family lines. They're benign, right? So we will refer to them as tumors, but they don't break off and go into other parts of the body, so it's not a cancerous process. They may start at their primary physicians, but they should consult with the gynecologist, someone who they can feel comfortable enough to really explain their symptoms. And oftentimes imaging may be required, ultrasounds, CAT scans, etc. And then the doctor and the physician should collectively decide what's the best management plan. Essentially, it's laparoscopic surgery, but it's enhanced with robotic technology. So we're actually able to take care of more complex pathology, larger uteruses, larger fibroids, with smaller incisions, less downtime, less bleeding associated with the surgery, and a faster return to work. And the incisions are dime size, versus a traditional open hysterectomy where you have a bikini cut that's about 6, 7 to 8 centimeters, or even sometimes we may have to make an up and down incision on the abdomen. So from a cosmetic perspective, it's nicer, more appealing, but they just heal much nicer because the incisions are much smaller. Not every patient is a candidate for laparoscopic and robotic surgery. Again, it depends on their own personal history of surgery. So if a patient that's had multiple abdominal surgeries, she may not be a good candidate for laparoscopy and robotic surgery. So Stephanie Williams is a patient that came to see me a few years back and complaining about her cycles becoming increasingly heavy and painful.
I came in 3 years ago to see Dr. Yancy because I had very painful fibroids.
So we sat down and talked about various options from conservative all the way up to the most invasive, and collectively we decided that we would perform a hysterectomy. But based on the size of her uterus, I thought she'd be a great candidate for a minimally invasive approach to hysterectomy through robotic technology. So she underwent a robotic-assisted hysterectomy, and she came through it with flying colors.
I had no more pain after the surgery.
Her post-op care was minimum. She was back working probably within a few weeks. Fast forward, she's still my patient. I've seen her actually a few years, annually, etc. And she does not regret ever having that procedure done.
Yes, I do more things now because I feel better. No more pain. Dr. Yancy is the best doctor. She diagnosed me with having fibroids. She assessed the pain. She took care of it. She took excellent care of me. She's constantly calling me, checking up on me, see how I'm doing, any problems, any pain. She's just wonderful.